Good afternoon and welcome everybody. Delighted to welcome you to this important session, Bridging the Digital Divide, Securing More and Better Funding for the Digital Transformation of Health Systems. So pleased to see the full room. I know some people are waiting to come in. I hope we can accommodate as many as possible and hopefully also many online. My name is Christoph Benn. I'm chairing this session as president of Transform Health. In my day job, I serve as Director of Global Health Diplomacy of the Joep Lange Institute in Geneva. I'm saying that because so many people approached me here at the conferences, have you switched jobs? Because they saw me in the program, as President of Transform Health. No, I'm still with the Joep Lange Institute. So before there is any misunderstanding, I thought I clarify that. But today, I welcome you very warmly on behalf of Transform Health, a global coalition and partnership that has the mandate to promote digital transformation for health to achieve, primary health care and universal health coverage, but also to work on, mobilizing more and better resources domestically and internationally to kind of finance the digital transformation so that we really achieve primary health care and UHC by the year 2030. And that is also the topic of today, because this coalition has engaged in a long kind of study to present to you this report that we are very proud to launch today, Closing the Digital Divide, because the coalition felt that there's so much going on in digital health, digital transformation of health, so many initiatives and technological breakthroughs and so on. But it's very difficult to know what is actually required for the countries. What are the key interventions? How can we prioritize and what do they cost? And before you can identify and describe that in detail, it is sometimes difficult then to argue for these finances unless you know exactly what this will be for. That's exactly what we've been doing. We'll present to you the report very briefly, and then we have, I hope, a very exciting conversation on this report, on the findings, and we have a fantastic panel that I think will illuminate that from many different perspectives. But first, I welcome the Executive Director of Transform Health, Mathilde Vosselund, who will present to you the report, the recommendations, and the key findings. Welcome to you, Mathilde.
Thank you, and it's really a privilege to be here today to present this new report that Christoph was just talking about. I do believe I have my slides up now, but they might still be coming. So first of all, I want to take the opportunity to acknowledge some of the organizations that have been working with us on this conceptual framework. So I want to acknowledge, obviously, Joep Lange Institute, Path, Digital Square, regional networks, and our partners in the region, RECAINSA, HELINA, AeHIN, GCCT Task Force, on digital health workforce development, ZIMAM, our Young Experts Tech for Health network that have been doing a lot of youth consultations for the conceptual framework. We also have some really dedicated members as part of Transform Health's resource and investment circle that consists of many donors that have also fed into the conceptual framework and the development of the conceptual framework, as well as a global research consortium that we set up for the development of the conceptual framework. I also want to acknowledge our funders, GIZ, BMZ, as well as Foundation Botna, who we are very appreciative of. So let me go to the next slide. I can't see the slides here, so there we go. So why a conceptual framework? So Transform Health believes that digital transformation has the potential to expand access to healthcare and accelerate progress towards universal health coverage and the Sustainable Development Goals. However, to date, the adoption of digital technology and data for health has been siloed and fragmented. This approach has resulted in uneven benefits of different population groups. We have reached a stage in the digital health journey where we need to think beyond the introduction of individual digital solutions and to focus on investing in the digital transformation of health systems in its broader sense. We need to prioritize actions and investments that will drive a more equitable, inclusive, and sustainable transformation of health systems, and particularly in low and lower middle income countries. But what are the financial barriers? And Christoph kind of alluded to this. Until now, we have been largely in the dark when it comes to this. So I think I need to go to the, oh, sorry, I'm going ahead. Oh, sorry, I'm going ahead too fast. Sorry about that. Little information exists about the amount of resources required for the effective digital transformation of health systems, how funding should be invested, and in what sequence. The amount of money invested in digital health by governments and external donors is also not routinely tracked. Without this information, governments have struggled to develop realistic, costed strategies or to mobilize sufficient resources. Furthermore, external digital health investment from development partners, the private sector and others haven't fully aligned with national health plans and priorities. So as the digital health transformation continues to accelerate, it is critical that investments are not only increased, but really directed towards addressing health inequalities and building stronger and more resilient health systems. So this is why Transform Health has developed a conceptual framework to guide investment and action towards health in the digital age, with input from more than 350 stakeholders. In this conceptual framework, we have identified and costed 9 priority investment areas in 78 low and lower middle income countries over the next 5 years. And these 9 investment areas are, you can see here on the slide. We have also identified other areas that will require greater investment to ensure that the enabling environment will facilitate the digital transformation of equitable, inclusive, and sustainable development. So by modeling the estimated cost of these 9 investment priorities, we've come up with an indicative figure for resource needs for digital to health transformation in low and lower middle income countries, including a 5-year costed projection for each area. So based on this modeling, we estimate that an investment of 12.5 billion is needed for the 9 priority investment areas that I just mentioned. And this includes 2.5 billion in each per year. Approximately 2/4 of this total projected investment is for digital connectivity infrastructure within the health sector. Projected costs represent approximately 1% of annual government health spending, and around 60 to 70% of this investment could be funded from national resources, with the remainder needed to be funded from external sources. So while this provides like an indicative level of investment needs, the true investment requirement will ultimately be determined country by country. And countries obviously must take the lead in funding their digital health systems. And additional resources from donors and agencies, philanthropic organizations, and the private sector are also critical. So it's really essential that we invest in coordination and alignment of international investment moving forward. So, as well as outlining the amount, as I've just done, the conceptual framework also offers recommendations for how digital transformation of health should occur. And this report includes 6 recommendations. So firstly, we call for more investment from domestic and international sources to support digital transformation of health systems that are equitable, inclusive, sustainable, and protective of people's interests. The projected average funding need of 2.5 billion per year for the next 5 years should be considered as a baseline and not a ceiling. The true investment requirement will ultimately need to be established and determined country by country and based on costed digital health plans. And secondly, and I need to fast forward here a bit, we call on international donors and the private sector to ensure that their investments are coordinated and really aligned with national priorities to reduce fragmentation, duplication, and waste. Similarly, at national level, all stakeholders should improve coordination using the principles for donor alignment for digital health as a blueprint. And we also recommend, in order to enhance transparency and accountability, we call for institutions like the WHO, multilateral development institutions and donors to really work together to develop tools for tracking funding for digital health as part of the wider health investment framework. And then a third recommendation is for countries to develop or to update existing costed digital health strategies and sequence investment roadmaps that lay out the different sources of funding as well as the gaps. These strategies must reflect the country's level of digital health maturity and promote interoperable solutions for connectivity, capital investment, data governance, legislation and regulation, literacy, and workforce. And then we have the fourth recommendation. And the fourth recommendation is for national governments to establish a robust regulatory framework and policy environment to guide the digital transformation of health systems so that it's inclusive, equitable, and sustainable. And I will then go to our fifth recommendation of the conceptual framework, which calls for mechanisms for meaningful multi-stakeholder engagement in digital health policies and governance frameworks. So what we mean by this is for digital transformation to be effective in improving health outcomes and accelerating progress towards universal health coverage, civil society, including particularly young people, women, and marginalized communities, need to be involved at all levels of planning, strategy, execution, and monitoring of this digital health transformation. And the final recommendation is to close the digital divide and in terms of digital access. This is really a prerequisite for equitable access to technology-enabled health services. And this means that we need to confront access to technology, affordability and digital literacy. And it really requires political will at all levels of civil society engagement to mobilize policymakers and to really generate public awareness. If ignored, the divide in connectivity will widen and the equity gap in healthcare access will increase. So as a summary, the conceptual framework not only uses the scale of investment required in not only shows us the scale of investment required in low and lower middle income countries, but it also frames how this investment should be used to steer digital transformation of health that brings us closer to UHC and health equity. This conceptual framework is really an important step in Transform Health's journey to advocate for increased and coordinated investment in digital health over the coming years, by bringing particularly the voices of the marginalized and disadvantaged to the table to ensure that investment is better coordinated, aligned, and representatives of the needs of these groups. So finally, I just want to say that I really look forward to hearing all of your reflections on the framework and to discuss how we can work together to mobilize the necessary investment and translate these recommendations into action. Thank you so much.
Thank you so much, Mathilde. It's not easy to summarize 10 months of intensive work and a 50-page report that is being launched today in 10 minutes. So very well done. Thanks, Mathilde. I think you all know now what we are talking about. You have also the infographic. You found that on your seats. So we are ready to go into the panel discussion. And I'm really delighted to have a really exceptional panel today that can talk about this topic from many different perspectives. But I would like to start with Dr. Maria Endang Sumivi, who is the Director General of Public Health in the Ministry of Health of the Republic of Indonesia. Of course, this year, the whole world has looked particularly at Indonesia as the G20 president. You had also digital health on the G20 agenda. So that's great. You put a lot of kind of priority on that. But we also know that in Indonesia, you have a strong focus on primary healthcare and also on the digital transformation. So we would love to hear from you how you see the contribution of digital transformation towards primary healthcare, universal health coverage in Indonesia, but also maybe a little bit to touch upon how you see the role of domestic and international funding for that. Thank you.
Thank you. I will start with the sharing experience of what happened during the pandemic. So during the COVID-19 pandemic, we experienced unprecedented acceleration of digital health transformation because we developed the application for telemedicine. We work with 20 startup companies, and daily we actually perform consultation to 7,000 self-isolated patients with telemedicine service. And we deliver 6,000 medicine packages daily during pandemic. This is also to the self-isolated patients. So we experience this a very big digital transformation. The second one, we developed the super app called Peduli Lindungi from the word care and protect, that is used for movement control, also for vaccine certificate registration, also COVID-19 test record, so that people can be controlled during the movement. And it is downloaded by 100 million people and being used actively daily by 8 million people. So during the pandemic, we have that experience. And when we look at the current situation of our data system in the primary healthcare, in the hospital, and in the clinics, in the pharmacy, we have a very fragmented health information system that makes us not very efficient in making decision for the public health decision. And therefore, after the pandemic, we really go into the making the blueprint for the transformation of digital health information in Indonesia. We have just launched also the platform for data exchange between different facilities that will gather 10,000 primary services, 17,000 private clinics, 3,000 hospitals, 1,000 laboratories, and 30,000 pharmacies to be able to perform one big data for health in Indonesia. And for the primary healthcare, our vision is that this data can be used to visualize data problem at the village level, because we have rural settings, we have urban settings, but the one who really tackle the health problem is really in the smallest administrative areas. So all of the data that come from primary healthcare, hospital, clinics, we will visualize it in the dashboard that can be used at the village level for tackling the health problem at the village level. That's the vision for the primary healthcare strengthening. However, we look at our infrastructure. We did the assessment of the digital infrastructure of our primary healthcare, and it's only 40% having excellent infrastructure. The other 60% is patchy. It's not that they are not existing, they are existing, but it's not adequate. So that's also our homework. So the priority for financing from our side for the digital health transformation, number one is for the infrastructure, digital health infrastructure in the health facilities. Number two is for the development of health big data through integration and standardization to cover about 60,000 health facilities and records from 270 million Indonesian people. The third one is for the expansion of telemedicine, and the last one is for the citizen health application. So this is our direction. Thank you.
Thank you so much for these excellent examples of how you are putting already digital transformation into practice for your health system, but also thank you for indicating the gaps that still remain, that need to be filled so that you can fully utilize those opportunities. And we are proud to say that Transform Health has a very strong partner in Indonesia with IAKMI, and we are very much looking forward to continuing this close collaboration with you and the partners in Indonesia. I would then like to turn next to our German hosts and to Dr. Tanja Rödiger-Vorwerk. She is the Deputy Director General in the Ministry for Economic Cooperation and Development, responsible for global health, but also a big champion of digital transformation, not only in the field of health. And we would be delighted to hear from you also a little bit how you see this kind of international partnership to advance this agenda, and how the international investment and the domestic funding can come together, and how we can really support these kind of costed national plans that then need to be funded to achieve the full potential of digital transformation. Tanya, the floor is yours.
Yes, thank you very much, Christopher, and good afternoon to everybody. So this report, Bridging the Digital Divide, More and Better Funding for the Digital Transformation of Health, gives us a sound idea on what can be understood as a better funding from sides of the donors. Among other points, the report highlights a better coordination and alignment, digital health strategies, and a multi-stakeholder alignment and engagement. And those aspects are highlighted with good reasons. On the one hand, the pandemic created a momentum we just heard from you, thank you for that, and the improvement of digital transformation all over the world and in many sectors. On the other hand, it led to uncoordinated multiplication of standalone solutions, standalone inter-silo interventions in the health sector. And to be honest, Germany is not the best performer in that. The call for better alignment and cooperation, therefore, strategic approaches and multi-stakeholder engagement is not new. So to be honest, 4 years ago at the World Health Summit 218 in Berlin, the principles for donor alignment and digital health were launched in an event co-organized by the German government and by my ministry, the Federal Ministry for Economic Cooperation and Development, and the GIZ, and the principles were signed by more than 30 partners. At this point, we need to allow some self-criticism and recall the objectives of the donor alignment principles, which are to overcome fragmentation, duplication, and an inefficiency of investment. What can we all together do differently to operationalize the donor alignment principles today and after the experience of the COVID situation, and not tomorrow? So we need to renew our concepts and modes of cooperation, and from my perspective, that encompass, firstly, allowing partner countries to take ownership, to make sure that national challenges are understood and addressed. Individual and country bottom-up approaches are needed. Leadership and ownership of partner countries is key for moving forward. Secondly, leverage on multilateral partners and their strategies. We welcome the development at the global level as evidences by the inclusion of digital health in the new global fund strategy, as well as the soon-be-published Gavi Digital Health Information Strategy. The WHO Global Strategy for Digital Health provides guidance for global alignment. And we are happy that the WHO Data Hub is based here in Berlin, and we can align with them closely. Thirdly, converge our activities at global level and adhere to standards and centralized processes that are available. Aside of the donor principles, we have further donor coordination tools such as the WHO classification for digital health intervention and the WHO Digital Health Atlas. This is a platform that could be effectively used to store and disseminate information on digital health investment cases needed for these coordination activities that can be used from every country. And lastly, strengthen regional and national networks of practitioners and academia. This will guarantee that we meet the needs of individual population groups such as academia, diverse, equitable, and inclusive community of practitioners in the private sector are considered. This will also support the government to analyze domestic challenges and create incentives for better donor investment cases that will promote sustainable economic development and achieve the UHC. To conclude, we as donors should allow lessons learned from the fields to feedback in our standards and principles And this then can evolve in a cycle-based mode of collaboration and a redesign of our common processes. Thank you.
Thank you so much, Tanja. Very much appreciate your comments, and I hope you will also be delighted to see in the full report that we are calling for a renewed commitment to the donor alignment principles that were signed here 4 years ago. So it's fully recognized, but I think a renewed commitment to that is in order, right? It easily gets forgotten what people have signed, and we obviously want also more organizations to sign up to that. Also, thanks again for your support of the Ministry and GIZ for making this study possible. Next, I would like to turn to Mrs. Tzipi Livni. The world remembers you as a former Minister of Foreign Affairs of Israel, but you're also representing here the Nizami Ganjavi International Center. And you have many experts here definitely in the room and at this World Health Summit, and they will all kind of know that Israel is considered a real global leader in the digital transformation. I think you've gone much further than many other countries, including, I have to say, I'm German as well, so Tanja alluded to that. You know, Germany is not kind of exactly the leader in the transformation of its own health system, but Israel is. So I welcome your comments, you know, based on that and your recommendations to
Thank
us.
you. So I wanted to make this as a disclosure remark, saying that I'm not an expert on health, and I was just the Vice Prime Minister and Foreign Minister of Israel. But we are here, different leaders sharing, being part of an organization that works together with WHO in an understanding that there's a need globally to meet together the global challenges, including inequality in health and the impossible gaps between countries and we see these gaps within countries and between countries, and we believe, and some leaders are sitting here with me today here, we believe that we need to meet this challenge together. So just a few words about the global situation, about Israel, and maybe I can share also another perspective as somebody who is now consulting to different Israeli startups, including on health. But just an important remark, I believe, because we are speaking about the need to meet the challenge, but yet there is no place that organizes everybody and makes all or implement all the recommendations that you write. And I think that it's time, and maybe COVID was a wake-up call, saying that, okay, we need, of course, to deal with climate change. This is a huge threat to humanity, but yet we need also to deal with health. And I think that it's not a philosophical question, but the question is whether health is being defined as human right or civil right. I'm saying that it's not a philosophic remark, because if this is a human right, so everybody deserves an access to health. If this is a civil right, so each and every country deals with it internally. And and hopefully it will be defined as human rights, and in this case, there's a room for international community, for the United Nations, for international organization, also to force other countries to act accordingly. I'm raising it as a question, even though the WHO defined, saying, I'm quoting now, we believe that health is a fundamental human right, and everyone should have access to the health services they need when and where they need them. And the when and where is something that the digital health can provide. So this is just a general remark, speaking about Israel and also globally about what are the results or the understandings, global understanding, and also in Israel after COVID. Firstly, of course, that this is a global challenge, that it's not something that each and every country should and deal separately with. It also put the focus on inequality. I mean, as an Israeli, I was so happy to get the first shot, But frankly, when I got the third shot, there were others in different countries that didn't even get the first one. So living in Israel was good news for me, for my family, but yet as a leader, as somebody who is involved also in the international arena, I was thinking, okay, what's happening to others? Are they still in shutdowns or what is happening there? And another aspect that was also maybe changed our life during COVID is an understanding that we can cooperate without meeting in person. So this is true for a business matter, but this is also true to meetings with our doctors. And therefore, I believe that COVID also, in a way, created new ideas that are connected also to digital health. Now, speaking about Israel, I must say that for me, it's funny to say that we were surprised to see how good our health system is. But this is what happened to Israelis, and I would like to share with you how this works in Israel. So it's a combination of different factors. Firstly, we have the government, the Ministry of Health, which is basically the regulator. And we have the providers of health. These are it's called the Health Maintenance Organization. And there are around 4 or 5 organizations like this. And there's a competition between them. But the most important thing is that it's not a free market in terms that there is legislation. And according to the legislation, there's what we call a health basket. And this gives the minimum to any, not only citizens of Israel, but any residents, all the residents who are living in Israel, they are entitled to get everything which is in the basket health. And every year, there are discussions and negotiations. There's a committee deciding what should be added to this basket. And this is something that the government finances. So this is the right of every citizen, every resident in Israel to get. But this is the base. It's not enough. So on top of this, as I said before, there are the providers. And since there's a competition between them, they are trying to give better services, better health, and better access to doctors. And this is a moment in which digital health, this is something that they market. So today you can, if you're in Israel, you can see different providers trying to convince that they are better because you don't need to go to the doctor. When your child is sick, you can just text the doctor and he will connect you with video and you will show these kind of things. And this encourages the providers to compete and to offer to the public, not as part of the basic services, not that we need to pay more for this, but as part of the basic services, better healthcare, but also based on digital health. The government itself, not only the Ministry of Health, but the government itself encouraged Israeli startups, entrepreneurs, and innovations to deal and they fund different startups and ideas to have a better or new ideas that can that are focused on digital health. And of course, we are having in the private sector different startups, and these startups are speaking openly. We are speaking about those that will contribute to health, that's for sure, but this is not their main focus because they want to earn the money. So I'm consulting an Israeli startup that invented a patented, non-invasive wearable device for sugar in the blood, non-invasive. So now we are looking for investors. The government will not invest, so we are looking for private investors. Private investors are looking for yield. I mean, the idea that in the future the world can enjoy, or countries that are suffering for diabetes can enjoy it, this is not their first priority. And therefore, adapting what you suggested, I believe that there's a place for prioritizing what is needed. Speaking about regulators, about FDA, it takes time. Maybe also what is needed more. And the good news is that ESG now is a matter, it's become a bon ton of different investors, but ESG should include health. It's not enough. It's the beginning of, but there's a need for parameters for ESGs that will include health, and this will encourage investors to invest as part of their ESG policy also in health vegetation.
Thank you so much for your contribution. There were many, many valuable aspects in that. I think now we understand indeed why Israel is correctly regarded as a leader in digital transformation, but also thank you for mentioning two aspects that are running also like a thread through the kind of report that we produced, human rights and equity. Because that's at the heart of what we are arguing for, that indeed health is a human right, but also when we implement the digital transformation, we have to make sure that no human rights are infringed through the kind of digitalization, which is also a very important aspect, and the equity aspect, that this benefits everybody in need around the world, regardless of where they live. Thank you so much for that contribution. I wonder whether we have Diane Stewart, online, and can call on Diane now before I turn then to the panelists on your right-hand side. Hey, Diane, delighted to see you. Would have loved to have you here in the room. I understand why you had to return to Geneva, but great that you can join us. Diane is the Deputy Director of the External Relations and Communications Division in the Global Fund, has just managed a very successful replenishment in New York. Diane, congratulations. And also, and you will probably talk about that, is already a major investor in health systems, but also has a strategy for increasing the investment in digital transformation. So we would love to hear from you, Diane, what the plans are of the Global Fund and how this will contribute to the goal that we are discussing here. Over to you, Diane.
Thank you very much, Christoph, and thanks so much for allowing me to join you all virtually. It's a very interesting discussion. Certainly from the Global Fund's point of view, we really welcome this conceptual framework. We think it can really move us forward and bring a real step change in the way in which we work on digital health. As Tanya has already foreshadowed, the Global Fund sees this not only as an important investment today, and I'll talk a little bit about that, but we've incorporated this as a major aspect of our new strategy for the next 6 years. We think that harnessing data and digital solutions in the fight against the 3 diseases in particular, AIDS, TB, and malaria, but also in preventing future health threats is really an important component of our future strategy. Obviously, as we've been discussing, good data is essential for decision-making, and digital tools can make us all more effective. But what we see is really important is looking at some of the basic elements that need investment in order for us to have this good data to hand. And that includes strengthening the generation and use of quality, timely, transparent, and disaggregated digital and secure data at all levels. And that means starting really at the community and facility level and building up to regional and national levels within countries. An important element that some people have recognized, but which we at the Global Fund really see as central to the whole digital agenda, is around human rights principles. And not just in terms of access, which I totally agree with you, Tzipi, that it is also about access to all of that data for everybody, but it's also about the right to have your data protected and security and privacy of the way in which that data is managed. And particularly when you're trying to get disaggregated data that will be served to better serve key populations and vulnerable people, the protection of those data is really, really important for building trust in data collection, which is the first step in having good digitalized systems and good decision making. So the focus of our strategy will be there. I think the conceptual framework points to a lot of the weaknesses that we all recognize in the digital space right now, around fragmentation, around multiple overlapping initiatives, and and insufficient investment. But I think it bears recognizing that we've also made some progress, right? The Global Fund has a historical role in supporting health management information systems in low and middle income countries, which are really the backbone of the digital health systems. We already invest over 1.5 billion a year in national health system strengthening more broadly, and that includes over 130 million every year in health information management systems. We've also started catalytic funds for digital transformation, and I think we're going to support many more of those catalytic funds in the future. And we think that focusing in particular on, as I said, the community level data collection and information availability will continue to be a key part of our strategy. And we've made a lot of progress. DHIS2, which the Global Fund is a major investment in as an aggregator of health information, is now being used in 69 countries, which is huge progress over the last 10 years. 97% of the countries where we work that have huge infectious disease burdens have facility level AIDS, TB, and malaria program data digitized every month in their facilities, available for them to help use and guide their health management systems. And 58% of our core countries have community health information systems in place. And at least half of those are already integrated into the national health management system. So this is incredible progress at building up the kind of data that you can use to manage your health investments. And as was pointed out by Dr. Sumiwi in Indonesia, 41 countries have been able to add COVID-19 surveillance mechanisms directly into their existing national health systems already in the last 18 months. So I think COVID has also shown us that actually we can do a lot more, a lot faster, and have a lot more data available. So I look forward to talking a little bit more about how we can take this conceptual framework forward in really practical terms. It does require more investment, so part of this is about the money. But as we've seen, it's also about the fragmentation and the lack of coordination in the system. And so, in fact, the Global Fund is one of the signatories to the alignment on principles for donor alignment in digital health, and we will continue to let that guide our work. And I think we need to work even more multi-sectorally to make progress in the future. Thank you.
Thanks so much, Diane, and thank you for joining us from Geneva. The Global Fund has already been an active partner of the Transform Health Partnership, and we are very much looking forward to this close collaboration, and now really with exciting new opportunities. Following the replenishment, the launch of your catalytic fund, I think there will be so many opportunities to work together to kind of really implement this agenda. Thanks so much for that. Now turning to the table on my left, and first of all, to Alain Labrique, who is the Director for Digital Health and Innovation at the World Health Organization. Obviously, the World Health Organization is the central partner in all of that. And you and your team, you have played a very essential role also in producing this report. And thank you again, for an excellent collaboration with the WHO team. But from your kind of central position and your WHO strategy for digital health, what do you see as the resources, the systems, the processes that are required to drive this forward? And what will be then WHO's role in this? Over to you, Alain.
Thanks so much, Christoph. And it's such a pleasure to be here, not just with a distinguished panel, but really this room is packed. I can see the steam rising just from the audience. So I apologize that you're sandwiched together so closely, but COVID has also taught us that being together and being friendship is something we miss. So I'd like to go back a little bit in history, because I think when we're grounded in history, we have a better sight on the future. And so I think back to the early days when I started working in digital health. In 2011, the landscape of innovation in digital health in a country that's known to many of you, in Uganda, was, I'll use the word, littered with so many discordant efforts to harness the potential of technology to solve public health problems that the national government issued a moratorium on new innovation until they could get a solid handle on what was happening. Why was there so much reinvention of the wheel? Why was there so much duplication? And why was government being left out of the loop in so much of these investments? And so to think that as a result of that chaotic state of affairs and the government's fairly draconian response to the state of affairs came the principles for digital development that many of you in the room have probably read and have subscribed to. And subsequently, once they saw that it wasn't just the principles of digital development that would rally the innovators and the entrepreneurs around the table, but we needed also to go one layer up to where the source of a lot of these entrepreneurial activities were being spurred by, and that is the financing. And so with the leadership of the Global Fund, with the Bill and Melinda Gates Foundation and others, really bringing around the principles of donor alignment. And I think these two strategies were critical in shifting that conversation, that we don't want to see a proliferation of discordant innovation. We don't want, and I have to buy someone a beer every time I use this word, but we don't want pilotitis to continue in the digital health space. I heard a new word yesterday, which was appetitis, which the proliferation of apps now that we're also seeing. So I think, we have to ask ourselves that we've been talking about coordinated investments for all over a decade now in digital health. We've been talking about not reinventing the wheel. And to me, I'd like to see this not as a conceptual framework. I'd like to finally see this as an action plan. And the fact that we have serious donors in the room who have dedicated themselves to really being transformational agents in this. We have examples like Dr. Submiwi example in Indonesia, that leadership to show that when there is coordination, magical things happen and really transformational health systems are possible. So I think when we look at this action plan, how do we make it possible? And I think that when a country is equipped with that clear, costed digital strategy and a vision for what their end state looks like, what does this future health system do for the citizens of this country, then coordinating the investments that you need is a very, very different proposition. It's no longer this abstract concept we want a donor to invest $2.5 billion into. It is a clear roadmap that we are looking to achieve a human right for our citizens. And that's really the way we need to reframe this, this very, very important conversation. So what is WHO's role in this? And really, I think in the spirit of the German self-criticism, I think we have been doing a lot to try and bring structure to the conversation about digital health, that when you speak about digital health and I speak about digital health, we have a classification. And thank you to Minister Tanya for really being an advocate for some of the tools that we've worked so hard at WHO to bring into this ecosystem. But now it's really about WHO's role in norms and standards and guidance to empower countries to build those costed digital health plans. What is the enabling architecture that is needed at the standards level, at the interoperability level, for a country to stand up an ecosystem, like our colleague from Israel pointed out? When you build the ecosystem in which entrepreneurs can thrive, where the private sector understands the rules of engagement, when they know what types of APIs and semantic standards they have to use, then that brings down the bar of entry, the risk of entry, to play in that sandbox, to produce products that not only support the government's vision, but actually advance the cause of improving health for all. And so I think, we're looking at building competency frameworks. What does the health workforce of the future look like? What is the user side of things and what is the architect side of things? Do countries have that basic workforce capacity to stand up and sustain a digital health environment. But I think the other piece that's neglected, and WHO really has a strong role to play, and we're going to be augmenting this, is in understanding the enabling governance, policy and legislative environment in which digital health can thrive. The other day we were having a conversation about interoperability architecture, and the colleague we were speaking with said, you know, in order to do a canonical client registry or a canonical health workforce registry, it's not just a matter of putting out a piece of technology and having all the health workers entered into that database. There has to be a law that enshrines the fact that health workers must be certified and credentialed, and that those credentials have to be registered in this particular database, and that this ministry is the authority to hold and issue the credentials that this is an authoritative database. So there's an entire policy and governance environment that also needs to be created. So at WHO, we're also getting the buy-in of every technical department to transform the way in which we issue the technical health domain guidelines. And this is a foundational shift where the decision support tools, the decision algorithms, the data elements, all of the guidance around HIV, TB, malaria, primary health care, maternal and child health are now being created in digitally ingestible formats, so that when the reality on the ground of a digitally enabled frontline health worker is reified, then they can intake that guidelines coming in from WHO and be automatically up to speed in terms of the latest global recommendations. So these are exciting sea changes that we're seeing, and really thank you to the Transform Health Group for refocusing a light on this. We're at a unique intersection point where we can really gather together and see this change through. So I hope we're doing more than launching just a framework. I hope you will agree with me that this should be an action plan. Thank you.
Alain, thank you so much. I love your notion that this should be an action plan. And I'm looking forward, to implementing that with you, but with all of you here and online, because this can only be a collective, partnership that can implement that with many countries. We are just trying to facilitate that and encouraging that and enabling that through this conceptual framework. Thanks so much for that, Alan. We take up the challenge together. Next, I turn to Pape. Pape is the founder and president of the Baobab Institute for Health and Development in Senegal, but has a huge network, way beyond Senegal, and has been a very active partner in the development of this report. And really thank you, Pape, for that partnership with Transform Health, for all your contributions that you made to this conceptual framework. But we would really like to know from you, we talk about financing, of course, but there's also the element of political will, and it is linked, right? We will not make much progress on that unless there's also political will to implement this digital transformation. So how can we build that political will, and what role should civil society play in this, building this political will, building this kind of partnership that can really drive this agenda forward, this action plan forward? We want civil society as, being an engine for this action plan. Over to you.
Thank you so much, Christophe. And like Alain, thank you also, and congratulations for the new position. I'm very excited to be here. I'm excited to be here in person because we definitely missed this, but I'm most excited because we're in the midst of this transition, this shift that we're all going through. Let me just take a couple of minutes to remind us how much changes we're actually seeing in the landscape of development. I mean, this is clearly in the last few years have seen incredible changes and questioning of the current model, entry of new players in the field, new vision about working differently, and a commitment to thinking out of the box. I mean, these are new. I think these are signs that we are dealing with a model that is outdated, but we're also in the search of what the new model is. And I think this is where we begin to celebrate the role of digital and digital transformation. I think we all get excited. By the way, there's also the conversation, a subtext. There's the whole conversation about locally driven development, decolonizing global health, and all of that. But in the midst of that, it is also important that we remind ourselves that we're making progress, not just the kind of progress Diane was talking about in data, in some of the processes, but we're seeing some real progress. I think I've heard this week countries that are doubling their life expectancy. We are talking about eliminating malaria. We are talking about people living with HIV/AIDS, et cetera, et cetera. So we don't want to be throwing the baby with the bathwater. We want to continue to celebrate progress we're making as a global community. And even though there is a need and there is urgency to have programs that are driven from the countries, we want the same standard of care. We want the same level of quality that everybody deserves. So it's in this context that I think I wanted to answer the question about why is it important to have political will? Simply because the countries need to commit to an unfinished agenda / new agenda. And unless we have political will, all of the other things that we are talking about, how do we partner? How do we bring technology? How do we advance together? It won't happen really without political will. We saw what happened when we finally had global frameworks like the MDG, like the SDGs, that these frameworks are useful and they create a momentum throughout the countries, throughout the population, throughout the world. That's why actually I want to celebrate and I want to thank Transform Health for coming up with a conceptual framework. That's the beginning. We need a common framework that's going to facilitate the work, and that's going to facilitate having political will. Having said that, let's visit what this agenda is, because we are talking about using digital to transform health. Okay, so I wanted to take my few minutes to remind us what's still at stake and what still needs to be done. I think we're all committed and we all agree that reaching the last mile remains a priority for most countries. I want to add two other elements to that. It's also displaced population. It's also urban poor. In an era of urbanization where we are creating a new generation of poor people. So a political agenda to tackle these things should be a and I think countries will resonate very well if they're reminded that this is still unfinished business and new agenda really for us to commit to. Number two, we are still operating in a world where there is an acute shortage of healthcare workers. And I think it's fair to say, for the foreseeable future, we're going to continue to live in an environment of scarcity of health workers. Just like that. It takes a long time to train a doctor. It takes a long time to train professional workers. This is why we are so excited about digital, and if we can empower those community health workers. A digitally enabled community worker can do things, and they can accelerate progress, and they can help us reach these hard-to-reach populations, et cetera, et cetera. Wouldn't it be great if we finally realize the dream of having integrated program? I mean, our field is very siloed, let's face it. This is the most siloed sector in the development, because we think everybody will always finance health and so forth. We've gotten very, very bad habits. But it's very, very difficult for us to crack the nut of taking health into other sectors. We've got competing priorities. We've now got the environment, which everybody is agreeing we need to do better. And I think now we have the promise of digital to do this. And finally, Christoph is signaling to me, we need
We can't see him.
if we need to realize the dream of having a health system that cares for the person, a person-centered approach. I think digital might be the solution, might be the way for us to get there. I think all of these are the reasons why we need political will, but we also have to have the language to communicate that this is, and civil society is crucial in having this, not just for accountability, but for good partners to government and for continuing to innovate. Thank you, Christoph.
Thank you. And I would love you to continue for a long time. I could have listened to that very, very powerful message, and certainly share your dream and want to work with you, on making that a reality. Thanks so much for that. So last but certainly not least, we are turning to Susan Thomas, who is the clinical director at Google Health. And therefore, we're turning to the private sector that obviously, is already very, very engaged, particularly in this field of digital transformation and health. But would love to hear from you how you see the role of the private sector in the future and how you see these investments that are already been made by the private sector, very essential investments, how that can be aligned with those kind of strategies that we've been talking about here that we all want to support. Over to you, Susan.
Thank you. And let me start by saying how delighted Google is to be at the World Health Summit and in this session today. So much of what's been said already has resonated with me, remarkably so. Karen DeSalvo, who's our Chief Health Officer, has written one of the essays in the Global Governance Project's essay book that's just been released to time with this summit. And she's written about how access to healthcare, we need to democratize the access to healthcare, and how that's basically a human right. Back to the point that you were making earlier, it is a human right, I think, not a civil right, and we feel very strongly about that at Google. The pandemic proved to us, I think, how important that is. We saw during COVID that almost overnight, Google became a public health repository, the almost essential public health repository for billions of people around the world as they turn to our services for information. And so we had to lean into that. And therefore, information and getting the right information to people is so critical. So then thinking about the investment side of things, I think it's important for, clearly funding is important. Clearly the pounds, the dollars, the euros are important. And Google.org, our foundation, made investments of donations of around $1 billion during the pandemic to support the WHO and other organizations in delivering messaging and so on and so forth. But I'd like to think of investment as well in terms of research and development and getting products to market, time and resources. And that's where Google and Google Health really want to focus our efforts, because that's where we think we can have the biggest and the best impact. And I guess there's 3 guiding principles which we think about when we're trying to work out what products we should be building and how we do that. The first is, where possible, let's open source things so that we can make our tools and information as widely available as possible. Those advancements being made possible for people to use, and we do that increasingly. The second is build local teams. And I'll just caveat all of this by saying we haven't always got this right. We are a learning organization and so on. But we don't want to be just a paternalistic company sitting with people on the west coast of America telling countries how to digitize their healthcare systems, how to deliver healthcare elsewhere. So we know the importance of building local teams that we can work with. We've got big teams growing in India. We've got an increasing presence in Indonesia, in Kenya, in Ghana, and so on. And we want to expand that. We think that's really important. And the third is build really powerful partnerships from the get-go. We've done that with the WHO, and we're working really closely across a number of areas with the WHO, working with ministries of health so that we build and understand that local priority. But even more important than that, build those partnerships with local players, local SMEs, so that we have a vibrant network of entrepreneurs and people who are really understanding the healthcare needs of the local populations. So if I might just give you a quick example of that before, and I know we're tight for time, but I'll talk briefly. I didn't know that Alan was on this panel, and it's kind of like he set me up for this, what I want to talk about now. But Alan was talking about, the siloing of data and how information doesn't flow and so on, and the importance of standardization of that. And I think many of you will know we're moving to this sort of better sort of universal language of HL7, FHIR standards, etc. And how if we get to that, then we can start to really build powerful population health registries. We can start to do analytics. We can understand the needs of health populations so much better. And so what we've been building is something that we've called our FHIR Android SDK, Software Development Kit. So it's built with the FHIR standards within it. You can build applications that can be used on an Android phone very simply. Getting to the FHIR standards is slow and cumbersome, and it's a bit of a heavy lift. So we've been doing that, right? We've got the people and the resources to be able to do that. That SDK is on GitHub. Developers are using it. We've done the heavy lift. And the reason for doing that is we think that's the best investment we can make so that local players don't have to do that hard yard and they can get into delivering healthcare much more quickly. And then that information can flow and they can share it with partners, with ministries of health and so on and so forth. So I guess speaking to where investments can come from, I think they come in all shapes and sizes. We want to be embedded with local teams, really delivering that final mile that we've all spoken about.
Great and really reassuring message. And I want to let you know also that part of the process of developing this conceptual framework was a particular consultation with the private sector. So it has been, integrated into this conceptual framework. I hope you will recognize that in the report. And obviously, we do see the private sector as a very essential partner in implementing this action plan. So thank you for being here with us. We have a few minutes for questions, both from the audience here in the room and also online. I understand, I will get some questions that I can see here, on the screen. It won't be enough time, as always, to address all the questions, but I will take a few questions from here and then we will discuss maybe or indicate how we can, continue that conversation. I see two arms up here. Please go ahead. Oops, yeah.
Thank you already for the panel. That was really interesting. I'm trying to be a bit synthetic because we have a lot.
Introduce yourself.
Oh, yeah, sorry. Oscar from France as a pharmacist. Okay. And one point that was actually talking about with Diane was the security, the safety of the data. And one point that I wanted to raise was there's a lot of ransomware attacks right now. And the problem with, it's a bit messy. What I wanted to ask basically was how can we ensure that the policy will be homogenized with every country, but also by keeping the innovation at the ground level, not only in the institution, and keeping it with safety with regards to cybersecurity. Thanks.
Thank you. Great question about security and safety of data, absolutely important. Mike, and then the gentleman over there.
Hi, thanks, Christoph. My name is Mike Podmore, Director of Stop AIDS, but also part of the Digital Health Rights Project Consortium. Then we've been pleased to work closely with Transform Health Coalition on this important topic for a couple of years. And our consortium has a particular focus on the intersection of human rights and digital technology from the perspective of young people, civil society and communities, looking at the opportunities, but also crucially at the risks. So we'd like to commend the report for its strong language on addressing inequalities, marginalization, gender, governance, youth participation and digital literacy, and the need for funding for civil society. However, the 9 priority investment areas don't specifically include community engagement, advocacy, or digital literacy. And so it will be challenging to really ensure a focus on equity and inclusion without concretely identifying these areas in the 9 priority investment areas. We all hope, obviously, that the conceptual framework and the priority areas will guide others about what needs to be funded. But if these key interventions are not included, then they won't be funded. We've seen this consistently across different sort of funding frameworks across global health. So that means that civil society empowerment, advocacy and digital literacy will be a nice to have, an add-on, and not sort of at the core of the funding for this critical work. So I just end with a question really of, can these crucial areas be included in those priority areas as the sort of the framework is developed, or are there other mechanisms that we can ensure that these are central to our work on digital? Thanks.
Thanks, Mike. And a question over there. I saw there was a hand up early on.
Thank you. Congratulations for the report. I'm Francisco Becerra. I'm the Regional Health Advisor for UNOPS in Latin America, former PAHO Assistant Director. I think that this is an amazing report, and I think it's amazing things moving forward in trying to coordinate the whole digital growth and system within the system of health, and providing all the support and engaging community to reach them as well. But one of the things, and I don't know, haven't read the report and the recommendations, of course, is there any on the maturity of the digital system within the health system? Because I guess that there's a lot of digitalization going around, but if we want to improve the digital health for decision making, for strengthening health system to deliver better healthcare, is there a maturity model to move forward and see this is what you have and this is where you want to reach? You have to do this and this and this to really have a strong digital health system for decision making and supporting the community. If we don't have that, and amongst them, of course, is the legal framework, then it's going to be again growing wherever they want with patches, solutions there, and not really strong system moving forward. Thank you.
Okay, if you look, the microphone is coming.
Hi, I'm Daniel Messer from PSI. I have a question regarding, well, it's actually for Google and for you, Alan, which you would have expected, but it's about the framework and standards. I think the whole community is thrilled that we're going to that direction, because we were talking about pilotitis, and if we can really get a standard on the data structure, let's call it, it'll be a huge development for not just apps, so we get proper hepatitis, but also for the data and for the analytics side. What my question is like, we are here a large community from all kinds of different organizations, health institutes and so forth. How can we effectively contribute to the development of the FHIR standards, as well as the WHO brilliant healthcare guidelines that are coming out that should then go into FHIR? And my question with Google is like, the community has invested a lot in the past to progressive web apps, although we love Android, of course. And how can we cover that area so that we have FHIR compatible progressive web apps as well? So it's sort of these two questions. Sorry, I was a little technical last one. Sorry about that.
That's perfectly fine, and great to see you. All panelists at the end will get 1 minute, to respond briefly from their perspective. I would suggest that this question to you, Alan, and to you, Susan, you include maybe in your final statement rather than direct response now to the questions, but that you keep that maybe in mind. I know there was a question here, and then I will close the list.
Thank you. I'm Brooke Partridge, CEO of VitalWave, and I have a question for Minister Tanya about the principles for donor alignment. We had the privilege of facilitating that process of creating the principles along with the donors. So I've been pretty close to it over the years, and there's no lack of commitment from the donors themselves, the individuals, in putting them into action. So the impediment seems to be institutional in some way. So if we're going to recommit to those principles, what needs to change in order to make them more successful?
Great. Thank you very much indeed. As I said, I think I will close the list here so that we have time for a final round. And maybe in the interest of time, I will address some of those questions very briefly. I think security, safety of data, absolutely critical, I think, in all that we are considering. And then if anybody from the panel wants to comment on that, we welcome that. But, it's built in as a kind of requirement, if you like. We very much emphasize the trust, the confidence. People will not share the data voluntarily unless they have trust in the security of the data. So, Mike, thanks for your comments. With you, I can even disagree slightly. We've been discussing that for such a long time, because I would argue that the role of vulnerable communities, has been addressed, and is certainly central, for Transform Health and for all that we are, advocating for. And the kind of digital literacy, actually, it's even here in the recommendations, in recommendation 6, the final sentence is, this means confronting coverage gaps, affordability, and digital literacy. So rest assured, that is a key element. We recognize it's not only to have, internet coverage. It is about, how can people connect meaningfully with these tools, and that requires digital literacy. So we think also, we are suggesting it requires investments in that. Capacity building, enabling that. That's a central element of that. But happy to continue that further, Mike. And then also the question on the digital maturity index. Yes, I think it's quite prominent also in the report, and I'm very happy to recognize Laurie Werner, representing PATH, because PATH has been a key partner for us in developing this conceptual framework. And PATH and Digital Square, actually, you've been building some of your analysis on the digital maturity index that you've been promoting. So it is in the report. You will see that it's very much addressing that. And I think the other questions, I encourage, we can take up with the panel. But I just checked with Matilda that there will be probably many more questions that you might have, and also the online audience might have. And we encourage you to send us these comments. Today is the launch of this conceptual framework. That means it will go live online on the website of Transform Health. And there will be an opportunity then also to send comments or questions. So I really encourage you to kind of respond to that. This should be a living document. We've never kind of designed this as the final answer to financing digital transformation. This is a step on the way. And this will need to be developed further and further, but we thought this was an essential first step that we would love to kind of develop further with you, so that we can implement that. So that's just an encouragement. If you couldn't get the opportunity to ask your question, there are other ways to do that. With that, I would like to, turn back to the panel and say one very brief question. We've looked now at this conceptual framework, increased, better coordinated investments. What is needed to galvanize commitments? And what do you see your role in that? 1 minute, please, from all the panelists. And again, I would like to start with you, Dr. Sumivi from Indonesia.
From our side, I think the commitment is very high towards the digital transformation, because it's really where we should go. So this is really the direction that we really want to pursue, because from the experience, we see that this can be also, from the other panelists, this is very important for the universal health coverage. But I would like also to just highlight and also would like to thank also the contribution from a lot of partners during our pandemic, where we receive abundant resources, not only from the domestic, but also from the foreign support. For example, we receive around $20 million from Asian Development Bank, the FED, UNICEF, UNDP, World Bank, Global Fund, USAID, and to cover about 200 plus volunteers or developers and programmers. We receive also in-kind donation from WhatsApp, using unlimited WhatsApp for this, a lot of consultation and also telemedicine. So this has been very, very good for us, but this is because they are aligned with our digital transformation roadmap. So we really limit the pilotitis. And I just heard about this pilotitis and hepatitis. So because they align with us. So this is what is good during the pandemic. But from our side, we would like to pursue this further with all of you. From our side, we will do more socialization and dissemination on what we have done and what we will do, and make it as transparent as possible. and also giving impact report timely also. We would also like to map priorities from our roadmap and what donors can help, and also make sure that there is a regulatory support to implement the program. So that is from our side that we will do. Thank you.
Thank you so much. Great. Tanya, short final comment.
Yes, final comment and answer to your question probably. So what is needed, I think, with the guiding coordination principle, probably it's quite easy to galvanize it to digital by default. And digital by default means that there have to be common standards all over the world, and then it's quite easy to coordinate activities because you have a common standard. Thank you.
Thanks a lot, Tanya, also for being so brief. Mrs. Livni, final wise comments.
Well, of course, privacy is essential. It's according to legislation and regulation. And speaking about cybersecurity, this is something that we are all facing the need, not just in this case, but connected to security in general and, of course, to disinformation. Speaking about big data, we need also to mention that we can use big data not about individuals, but about community, and to use it later after analyzing for prevention, something that we didn't mention before. Secondly, speaking about the end game, I think that it can be connected only to the digital capacity, because while we are speaking, technologies connected to IoT, health, and so on are continuing, and this makes the gaps even bigger. So we should focus basically on the digital capacity itself. And the good news is that I think that, that digital health can be incentive to promote and to invest more in digitization, because until now, digitization was mostly about information. Now it's about life and death. And part of the outcome or the results of the Israeli experience is that it cut the budget. When you're using digital health, in the end of the day, you are paying less. So it's worth it also from this perspective. And another conclusion which is important is the coordination and cooperation. So there are those that should share what is needed, those that will invest in it, and those that will make the connection. It's not just one sector that can lead this project alone.
Thank you so much, Ms. Livni. Diane, over to you for a final word.
Thank you. So I would agree on the issues around coordination and fragmentation. We absolutely have to address that. And one of the ways we need to do that is by agreeing on prioritization. So agreeing on some key priorities, 9 is still quite a long list, I would argue. And so what we do first and how we invest in that is really important, which is why we're leaning into our catalytic investments, where we can show quick results and really overcome obstacles. But what's really important in all of that is to be able to do it at scale. And so what I would argue that we really need to do is show what the return on investment can be of making these kinds of digital transformations at scale in countries. You need ministers of finance and donors to be able to see that return on investment in order that they make sustained investments and for us to sustain the entire approach. So let's make sure we prioritize and are very clear about what kinds of things we can achieve with these investments so that we can move forward together.
Thanks, Diane. And as you know, I fully support your call for scale, right? That's we're very passionate about that. So over to the panel on the right. Maybe this time I start with Susan and go that way. Alain having the final word. Susan, over to you.
Thank you. Regarding the question about web-based apps, I claim not to be a technologist at heart, so I'm not going to answer that in detail. I think our open sourcing is a helpful part of that through sort of allowing people to easily transition, hopefully, onto the Fire SDK. But it's a great question, and it's one I'll raise back with the team as we start to develop this further. I think in terms of what's really important for us is to continue to grow local teams, embed with partners so that we really understand the priorities that we were just talking about, so that we're doing the right thing as Google for wherever we are working.
Thank you. Very much welcome. Pape.
Yeah, for me, I think it's continuing to galvanize, especially decision makers, using language that they can understand, maybe a little bit more of literacy preparation, and then a little bit of demystifying the technology aspects to make it easy and a little less threatening for people.
Thanks a lot. And Alain, over to you.
When you're at the end, all the good ones are taken. So
yes.
come up with a whole new list here. But I think there was a point made just now by Diane about facilitating conversations, and I think that there's a big elephant in the room when it comes to country level conversations where ministers of health have repeatedly said how hard it is to get the attention of the Ministry of Finance and to have a coherent conversation with the key ministries that are important to digital health transformation. And it's not just a health sector decision, as many of you have said today. It involves ministers of health, ministers of finance, and ministers of technology, ICT, ministers of education. So what we were leading towards is really a whole of government coalescing around this shared vision for this to be successful. I think in terms of, I had a question that I'm going to reinterpret as how can others engage with WHO and with the ecosystem? We need all hands on deck to help transform the paper-based guidelines and recommendations that WHO has been putting out for decades into their digital counterparts. So that means helping us, as others have done already, to build these digital adaptation kits. There's several already online, and you can see the wide range of partners we've worked with to create these adaptation kits. The kits have to be, that digital conversion has to be not just consistent with the evidence in the technical area, but also with the interoperability standards, HL7 and ICD codes, et cetera, that are required. I think we need private sector's commitment, continued commitment to contributing to this collaborative ecosystem. So please, I implore you, don't build behemoth responses that can solve all problems. Foster an ecosystem where many can thrive and work together to optimize. As really, I have to commend Google for creating that environment in which many entrepreneurs, local, international, can work together and solve these health problems. Lastly, I think, I grew up as a storyteller, and I think we have to see this as the seeds of innovation for the last 2 decades have failed to thrive in the way that we want them to. So we have to invest in the fertility of the soil in which we plant those seeds. And I think the conversation today has been about that fertility so that we can have an entire forest of success surrounding us in the future.
Thanks so much, Alan. And thanks so much for all the wonderful contributions. It was a fantastic panel. Thank you all for that. Well-deserved applause for that. And now it gives me great pleasure to introduce to you the speaker for the closing remarks. Yassine Ndiaye, who has not only been a critical member of the team that actually has been drafting and preparing this conceptual framework, but also represents the Young Experts Tech for Health, the group that is an essential part of Transform Health, gathering the voices of young people around the world, which is absolutely critical for all that we do here. You have the final word, Yassine. Thank you so much. Over to you.
Thank you so much. I think, as Alan said beautifully, when you're the last one, all the words are taken and all the time is taken. So lucky for you, I speak fast. So I will try to do this as quickly as possible, given that we have 2 minutes. So first, I want to thank really everyone here who has participated into the development of this work. And there's a lot of people in this room who, over the past year, have been put in a lot of work, the Transform Health team, the partners, both at the regional and global level. So really congratulations on this amazing work. And it has been an honor and a pleasure to have been part of it from a professional and also from a young person perspective. And also, I think one thing to mention, from a youth perspective, I think this has been also a true dream in a sense, or three example of meaningful youth engagement. I think for many of us, many young people, we have been very vocal about being part of the solution, being part of the design. And this has been an opportunity for all of us for me and other young people to be part of it, and people from different parts of the world as well, and from these LMICs countries as well. And so on that note, I think I'm really happy to see a lot of young people here. I'm also not being the only young person in this panel. I have Alan here who's a young person. So I see people have been, so it's always great to have young people here. So I see that many people have been at the session earlier. And again, this would be also a repetition of some of the things that were said in the session earlier, but also in this panel. And I think that emphasized the importance of those words, of those issues. And I think I will hopefully in the closing remarks do justice to them. I think one of the first ones is around trust. I think Diane from the Global Fund has mentioned that around data governance. And I think, a couple of months ago, we were at WHA talking about health data governance, also great work that Transform Health has put together. And I think this goes hand to hand with what's happening here. Without trust, we can't build infrastructure. Without trust, infrastructure will be void. If communities can, trust into the system, then we're doing the work for nothing. It's just beautiful connection, beautiful things, and they will not serve the role they were meant to serve at the beginning. And also another thing that has been very recurring theme throughout the conference is equity. And I think it is here, and we all keep talking about it because of how important it is. And I think I was at a session on Sunday, and the chair, Dr. Yode, mentioned something very important. And I think also it was mentioned earlier around definitions. I think it's time when we take this work into actionable work, as Alan again mentioned, we need to really think and sit and define equity. What do we mean by equity? Do we mean only access? Do we mean data literacy? Do we mean getting people who matter at the table? Do we mean getting marginalized people the lead? What do we mean by equity? I mean, it's a beautiful word and we all are behind it, but as long as we don't have the right definitions, we don't agree on the definitions together in the context in which we are working, then we end up years later looking back and seeing how we have failed at really getting equity where we want it to be. And the last thing, I think also the same chair mentioned, and me coming from a low middle LMIC, was around transactional costs. I think this is something we often forget, but when we come from this world, we understand the beauty of technology. We understand the impact it can bring. But how do we go to the community and explain to them, we are bringing you this, but then there's a cost to pay. Ultimately, I'm no economist, but I know anything you do, there's a cost to pay. And we need to make sure that communities understand that. And when we are asking them to trust us again, when we're asking communities to come and join us into this ownership of this beautiful and transformative work, what are you going to pay? Does the cost outweigh the benefits? Because if it does, it's time to stop. And so I think these are really important questions to ask in order to gain trust, build ownership and sustainability of the program and what we're trying to do, and these actions that we're trying to take to really invest in digital transformation. And on that note, well, I'm 3 minutes over, didn't do well. I want to say that hopefully next year we'll be here again, but hopefully talking about a country from the LMIC group that have exemplified all of these things, a country that will have shown us how to take this framework and turn it into action while being inclusive, equitable, however they defined it, and hopefully, it includes everything that we've talked about. I mean, that's the best of both worlds, right? And also, how do we make sure that people are engaged, that community are engaged? Because ultimately, what we want to do is leave no one behind. Let's make sure that community is at the center and driving this work. Thank you so much.